Okay, what I'm going to do now is show you how the post-op brace is used. This is a special brace called an Ultrasling. It's actually the Ultrasling 3, developed with the help of the shoulder team here, but built by a company called Donjoy Orthopedics down in Carlsbad. Anyway, the Ultrasling has a special pillow that contours to the patient's waist, just above the iliac crest or the hip bone. It has 3 straps. It has a waist strap, it has a shoulder strap, and then it has a special strap called the derotation strap that goes under the arm. Let me talk about some of the things that make it special. Having a pillow against the side does several things. The obvious thing is it keeps the arm away from the body. Post-op, when the arm is held too close to the body, a lot of bad things can happen. One of the things is that the ligaments in the front of the shoulder can get real tight and stiff. If that happens, it's real hard to mobilize the shoulder and get motion back after surgery, especially starting physical therapy. The other thing is it's nice to have some airflow under the arm. If you hold the skin folds together too long, particularly in a post-op period when there's a lot of moisture on the skin, people tend to get rashing and sometimes even infections under their arms, so this will help prevent that. The third thing is if a rotator cuff surgery is done, holding the arm out just a few degrees will allow the blood circulation to the top of the rotator cuff to be much less constricted. It'll make it much more efficient, and so it helps with that. What you can see is the sling's made up of several straps on the hand. There's a thumb strap that is really for comfort. Some people choose to use it, others don't, but it will hold the hand up a little bit and keep your arm from sliding out of the sling. The second strap, I'll have Sina show you how to do those. The second is made up of 2 buckles, and that holds the wrist up and holds the sling to the shoulder. The third one here is another positioning strap that goes across the front of the arm. It sticks to the pillow on the medial side and to the brace on the outer side, and that keeps the arm from sliding forward. The waist strap here is attached in the front, and if you ever need to do any adjustment to your sling, you're certainly welcome to snug it up or loosen it with using the Velcro tab in the front and the Velcro tab at the waist. These things tend to stretch out a little bit, or sometimes you want to have a little more security. You can certainly tighten those up. Important to notice the position that Sina has the sling. It's not across the body in the front. The strap under the arm helps prevent that by connecting to the pillow in the back. So if the sling tries to migrate, this strap stops it. The other thing this strap does is help pull some of the weight off the strap going around the neck. I've had patients complain that they get pain in the muscle on the side of the neck, and this strap will help pull that away. So turn around and we'll show them how the straps work in the back. The shoulder strap comes around, goes through a buckle in the back, and it's tightened here. Your doctor will do the adjustment on that. The strap that goes under the arm actually comes across and hooks to the pillow, and this is the one that prevents the pillow from migrating forward. The waist strap is adjusted, and as I showed you, can be done in the back. Now, Sina, could you show us how to take the sling off when the patient's at home?
Sure. The way I like to explain the sling to our patients are basically that we have 2 main systems. We have the upper strap, and I like to refer to it as the book bag strap, and then the lower strap, which I refer to as the seatbelt strap. Basically, the top one is the one that goes around your shoulder and your armpit, and it comes on off just like a book bag does. And the lower one basically comes across your chest just like a seatbelt would. When you put this sling on, I like to put the seatbelt on first and the book bag last. And when I'm taking it off, I like to do the opposite. So I take the seatbelt off first, and then, I take the book bag off first, followed by the seatbelt, which I will demonstrate right now. Basically, I have the strap on, and I'm about to take my sling off for either my exercises or any other reason. So I look at these clips right here, and I unclip these. They're little round tabs where your fingers go, and you press those buttons and it unclicks these. And now I take this top strap off like I would a book bag strap. And now my arm is loose to go ahead and remove the straps off the forearm and the thumb, releasing this flap on the Ultra Sling. Now the only remaining part is a seat belt that holds the pad on, and now if I release that, I can remove the brace and I'm free to do my exercises or other functions that I need to do without my brace on. Now, having the sling off, I've completed whatever tasks I need to do, and now I'm putting my sling back on. Once again, we put the seat belt or the pad portion on first, followed by the upper part, or the what I call the book bag part. So put the arm pad next to our bodies, and we basically grab the seatbelt strap from behind and click it in just like you would a seatbelt. Now you have your arm at the side. You want to secure it. So you grab the flaps of the Ultra Sling, bring them back together. You put your arm strap and then your thumb strap on, and now your arm is back and secure inside the sling. Now the next portion we have to do is put the book bag on. So just like you put on a book bag, you basically thread your arm through the armpit and the shoulder straps, and here we are back to where we began, about to click into the final step of putting our strap in, of one click and then the second click, and we're back into secure sling position.
One thing that I should mention too is the little red ball. It's absolutely critical that we maintain good health, good physiology of the muscles in and around the shoulder. And so what we'll do is demonstrate the exercises that we're going to ask you to do post-op. We'll go over those with you in the clinic before surgery, but one of the exercises is squeezing the ball. You squeeze it as much as you can to get the muscles of the forearm, wrist, and hand active so that the circulation is improved. It'll help call in circulation through the shoulder to help get rid of the swelling, get rid of the old bruising, and to stimulate healing. What I'll do now is just demonstrate the integral parts of the sling portion. First of all, up front we have the thumb strap, and the thumb strap connects by Velcro to both the front and the back. Some people like using this and others prefer not to, but it's an option. It helps maintain the arm in position. It cocks the wrist up a little bit so that it doesn't tend to put stress on the bottom of the hand. The two shoulder clips hold the strap that goes over the shoulder and are released with a push of a button on the rounded portion of the clip. They click in and they're released just by pushing the button. The third strap is the forearm strap that goes just in front of the humerus. And again, Velcro on both sides. It's made of a special padded material, and it can be used as snugly or as loose as the patient feels for comfort. Sometimes during the summer you may not want to use it at all. Other times you can snug it up, but it keeps the arm back in the sling in good position, and it gives you a sense of stability and comfort.